Yes.
My name is Abidemi Ola. I study at Walden University in the FNP program. I'll be doing a health assessment this morning. Hi, my name is Abidemi Ola. What brings you here today?
I'm having neck pains in the right side of my neck.
Okay. How long have you had this pain?
I would say between 4 to 6 months.
Okay. What's your name? Can you state your name, please?
My name is Muriel.
And how old are you?
I'm 43.
And what race, what ethnic group do you belong to?
African American.
Are you married?
I'm divorced.
Okay. Is there any hearing or vision impairment that can get in the way of you understanding me this morning?
No.
Okay. All right. So going back to the pain that you've been having, what's the pain like? When did it start? How does it start? Is it gradual or is it spontaneous when you start experiencing this pain?
It's constantly there, but if I do certain movements, then it aggravates it, so it gets worse with certain movements that I do.
Okay. And this pain is located on the right side of your neck, correct?
That's correct.
Okay. How long does it last for when you have this pain?
It's purely constant, but like if I move my neck all the way to the right, I could feel it, and it hurts pretty much there. Or if I bring my chin to my chest, it hurts.
So can you describe this pain? Is it burning? Is it hurt? Is it sharp?
It's kind of like an aching pain.
Okay. Do you have any associated symptoms with this pain when it starts?
No, not really. It's just kind of always there, and it kind of radiates to my shoulders.
Shoulders. Okay. Anything that you do to help relieve this pain?
I've done quite a few things. I've taken over-the-counter Aleve, ibuprofen. I've gone to my primary, gotten Flexeril. I've applied heat, and I've gotten a massage.
Okay. And which one of them has worked for you?
The massage has worked, but I only gotten it one time.
Okay. Just one time, you haven't been pumped to go back. You haven't been pumped to go back. Okay. So treatment-wise, it's just the massage that works for you regarding this pain.
At this point, yes.
Okay. So 0 being no pain and 10 being the worst pain ever. What number would you give to this pain?
If I don't do any movements or anything, I would say it's a constant 1. But once I move or I turn my neck to the right or my chin to my chest, it's about a 3.
Okay. All right. So I'll move on right along to your past medical history. I'd like to know a little bit more about you. So have you had any illnesses in the past that I need to know about?
No, none.
Okay. Any surgeries?
No surgery.
Okay. Any hospitalizations?
No.
Okay. Any pregnancies?
Yes.
Okay. How many?
Just 1.
1. Okay. So you have 1 child?
Yes.
Okay. Have you abused alcohol in the past?
No.
Okay. Do you smoke?
No.
Okay. Any illicit drugs?
No.
Okay. Do you use any prescriptions right now?
Besides the Flexeril that I was prescribed, no, but I haven't really been using it.
Okay. So what's your typical sleep pattern like?
It depends. It varies between 7 to 8 hours or so.
All right. So can you kind of think back into the last 24 hours what you've had to eat and drink?
Let's see. I'd say I've had bagel, orange juice. I've had pizza. And on my pizza, I had vegetables, which was like spinach and olives and tomatoes. And then I had hot dogs, coffee.
Okay. Water?
That's it. Oh yeah, I did.
Pretty much. Okay. All right. I'm going to ask you a little bit about your family, meaning your grandma, your dad, your mom, your siblings, and your child as well.
Okay.
Okay. Any cancers in the family?
Not immediate family, but extended family.
Okay. What kind of cancers?
Ovarian, breast, uterine.
Okay. And you said distant. How far out is it? Great aunt?
Yeah, my grandmother's siblings.
Okay. All right. Any high blood pressure or cardiac problems in the family?
My father is hypertensive, and that's it.
How long has he been, do you know?
About 2 or 3 years.
2 or 3 years. And is he well managed? Is he on medication?
I don't think he's on medication, no, he's not.
Okay. Any thyroid problems in the family?
No.
Any respiratory problems in the family?
No.
Any endocrine problems in the family?
My grandmother's diabetic.
Diabetic.
Mhm.
How long has she been?
About 30 years or so.
Is she on insulin or is she just taking medication?
No medication. She just manages it with exercise and diet.
Good. All right. Any arthritis in the family?
No.
Sickle cell anemia in the family?
My nephew and my niece have the trait, but not me or my sister.
That's pretty much it.
Mhm.
And of course, you said no epilepsy in the family.
Correct.
Okay, good. So going to your social history now, do you drink?
Socially, I do.
Okay, so what do you drink?
I have probably two glasses of wine or so, probably in a month.
In a month? Okay, do you smoke?
No, I don't smoke.
Okay. Do you use any illicit drugs?
No, I do not.
What's your highest level of education?
Bachelor's in management.
Okay. And what job do you do right now?
I am a human resource specialist.
And you did recall your 24-hour diet
Yes.
already. Okay. All right. So I'm going to go on and talk about your system, meaning from your head to your toes, and just try to ask you a few questions. If you have any questions or you need to stop me, please don't hesitate to do that.
Okay.
So, do you have any vision problems?
No, I don't have any vision.
Okay. Do you wear glasses?
No glasses or contacts.
Oh, okay. All right. Do you have any problems hearing?
Besides the low tones, that's pretty much it.
Okay. Any problems smelling?
No.
Do you smell unusual stuff?
No.
Okay. Any problems with your taste?
No.
Okay. Any dental issues?
No dental issues.
Okay. How often do you see the dentist?
Every 6 months.
Every 6 months. Okay. Do you have any problems with dizziness, lightheadedness?
No.
Okay. Okay. Moving on down. Do you have any thyroid problems?
No thyroid.
Okay. Any problems with swallowing?
No.
Any have you ever experienced any respiratory issues, meaning consistent cough, asthma? Do you have asthma in the family,
No.
or do you get to, okay, COPD, shortness of breath?
No.
Do you use this? Do you don't use any appliance to help you breathe better? You don't use oxygen. Okay, all right. So do you have any cardiac histories?
No.
You don't use any medications for high blood pressure. You don't have high blood pressure.
Correct.
Okay. No cardiac surgeries, no
No.
those. Okay, do you have any bleeding problems?
Nope.
Okay, all right. Moving on, GI wise, when was the last time you had a bowel movement and how often do you go?
Probably every other day and yesterday.
Okay, and peeing, do you pee often?
Yes, sufficiently.
Okay, and what color is your urine?
Pretty clear yellowish.
Okay, meaning you drink adequately?
Mhm.
Okay, can you give me an idea of how much you drink daily?
Probably not the 8 glasses, but close enough. Probably 6.
Okay, all right, moving on. Have you had any histories of any sexually transmitted diseases?
No.
Okay, what age did you start your menstrual cycle?
12.
12 years old. And what, do you remember the last days of your menstrual cycle?
September 12th, I think.
September 12th, okay. And your daughter, you had her regular vaginally?
Yes, vaginal.
Okay. All right. Do you have any aches or pains in your bones or any trouble walking or moving around?
No.
Any pains in your knuckles or your wrist at certain times of the day or when it's certain time of the year?
Mm-mm. I do have plantar fasciitis.
How do you manage this? Is there anything that you do?
I just do the exercises, which is the ball rolling. It's into my left arch.
Okay, and that's been effective?
Mhm.
Okay. All right, do you have any questions at this time?
No, I don't have any.
All right, thank you so much for your time.
You're welcome.